Thanks, Amy. Welcome, everybody. Before we get into our day talking about alcohol marketing, my job is to spend a few minutes talking about why we care about alcohol marketing, and I know that I'm largely speaking to a pretty well-educated audience, but I thought we should, just for this initial introductory talk, focus on the harm from alcohol, the big public health problem that it is. There's plenty of evidence that it's a big public health problem, and not just in New Zealand. The new Global Burden of Disease study was published recently, showing that alcohol is the third leading risk factor for health burden in the world. So of all of death and disability across the whole world, alcohol makes up more than 5% of the burden. I don't expect you to be able to read this, but up here we have the strip that pertains to alcohol, and you can see it's a particularly colourful strip. This didn't translate well from the Mac to the PC, I apologise. But the reason that alcohol strip is so colourful is that alcohol contributes to a vast number of different health conditions. So when you look at the burden of disease in the whole world, each one of those colours is a different group of health conditions. In New Zealand, we've also recently completed a burden of alcohol study, a repeat of the earlier work, that shows that alcohol accounts for 5.5% of deaths under 80 in New Zealand. So this was in the year 2007, and accounts for 14,000 years of healthy life lost every year in New Zealand. So these are the New Zealand data, and you can see that more than 40% of alcohol-attributable deaths in New Zealand are from injury. Injury includes not only unintentional injury, but suicide and violence. 30% now, this has, for a number of reasons, increased since the last study, but 30% of alcohol-attributable deaths are from cancer and nearly 30% from other chronic causes of disease. So one of the questions, and Jeff touched on this, is why, what it is about alcohol that causes this amount of harm, something that's been enjoyed for thousands of years in some cultures, but of course alcohol is a drug, and it has a mix of properties that make it particularly hazardous to humans, because the first of its properties makes it very attractive, and that's the intoxication. So alcohol's intoxicating, and the usually uncomplicated, pleasurable effects of drinking a small amount of alcohol rapidly gives way, to more problematic effects as blood alcohol levels rise. And a lot of alcohol's most visible harm is related to intoxication, not just physical health harm, but also the social harm that goes with drinking a lot of alcohol. But it's not just the impairment of physical functioning and thinking that goes with intoxication that causes the damage. It's just the most obvious. People are often surprised to learn that alcohol is carcinogenic, meaning that it causes cancer. And alcohol contributes to a range of different cancers, including the common ones, breast cancer and colon cancer, common causes of cancer death in New Zealand. And in terms of breast cancer, for women, one extra drink every day increases the risk of breast cancer by about 10%. There's no safe level of consumption in terms of breast cancer. And in New Zealand, in the new burden of alcohol study, breast cancer is the leading cause of death from alcohol for New Zealand women. As well as being carcinogenic, alcohol is directly toxic. So alcohol poisoning can kill people very rapidly, but alcohol is also causing chronic damage over longer periods of time, particularly to the liver, because that's where it's processed, and also to the nervous system, including the brain. And many of you will be aware that the effects of alcohol on the brain and nervous system can be seen in most markedly in three different phases of life. The first being to the unborn babies of women who drink during pregnancy and who are affected by fetal alcohol spectrum disorder. This is I mean, this is merely some physical outward morphological signs of fetal alcohol syndrome, but of course it's the cognitive and learning effects that have an enormous amount of impact on young kids. The second phase is young adults who drink heavily before their brains are fully developed, up to about the age of 25, and there are quite a few studies now using this functional imaging that shows the impairment of cognitive abilities in heavy drinkers who have been drinking heavily when they're young. And then finally, in the end stages of long-term chronic heavy drinkers, there are a range of nervous system effects, including encephalopathies and peripheral nerve damage. And of course, one of alcohol's other properties is that it's addictive. And for some heavy drinkers, it's the addiction that drives their continued heavy drinking. But we mustn't forget that a very large proportion of heavy drinkers are not addicted to alcohol. They merely have a very pathological drinking habit. Now, some people might think that, or some people do think that drinkers are simply paying for their excesses with their health. And some economists even maintain that drinkers take the harm that they might suffer into consideration when they make decisions about how much they drink. But nevertheless, heavy drinking affects a lot of other people other than the drinker, and we need to keep this in mind. So we seem to be able now to understand about passive smoking, the effects on others, particularly on children. And we've largely given up smoking in our houses and in our cars, but we're not so good at acknowledging how much damage heavy drinking does to people other than the drinker. It's on a much, much greater scale, and it particularly affects those closest to the heavy drinkers, their partners and their children. And the children grow up with some or all of these sorts of handicaps, I've called them, but things that affect the rest of their lives often. Not only aggression directed at the children themselves, but the witnessing of chronic dysfunctional households and being surrounded by the effects on the other members of their family. The partners of heavy drinkers are obviously affected in a variety of ways, not just aggression and violence, but in a recent study of New Zealand general population that we did, we found that alcohol was involved in between a quarter and a third of all acts of aggression between partners. This is what you would call a low-risk population. This is not a previously violent or identified population. And 5% of the whole New Zealand population sample reported an aggressive incident involving alcohol in the last 2 years with their partner. So the issue of violence in general is complex, and everyone knows that there's more than drinking going on when people are violent. Like heavy drinking, violence is intergenerational and it's learnt behaviour, but there is experimental evidence that shows that alcohol increases aggression, and more markedly in men than in women, which fits very well with the epidemiological evidence as well. There are studies of people in violent relationships that clearly show the escalation of violence in the presence of drinking, and I think there's no doubt that alcohol causes an increase in the frequency and the severity of violence. There's quite a lot of data from the police and from self-report that show a very high proportion of all physical and sexual assaults involve a perpetrator who's intoxicated or has been drinking. And so these figures range from 30 to 60% of all cases of violence reported. And while alcohol's most visible harm to families is related to intoxication, that's not the whole story, and it drains the financial, the emotional and the physical resources of families in New Zealand, and it also affects the resources of the country as a whole. So the economic cost to New Zealand of drinking the way that we currently drink has been estimated at about $5 billion a year. And when you think about our inability to provide free education, fair benefits for those who need them, and accessible free health care, it's galling to be paying the cost of heavy alcohol use, regardless of our own use and regardless of our efforts to do something about reducing that cost. So people ask, what's so different now? In some parts of the world, alcohol's been drunk almost forever. It's always provided entertainment and it's always caused problems. And people often say this to me, this is no different than before. And this is from the 4th century BC, 3 bowls. Do I mix for the temperate? 1 to health, which they empty first, the 2nd to love and pleasure, and the 3rd to sleep. When this bowl is drunk up, wise guests go home. And you can relate that to that chart of the effects of blood alcohol on your behaviour and your thinking. But this is what happens. The 4th bowl is ours no longer, but belongs to hubris, the 5th to uproar, the 6th to prancing about, the 7th to black eyes, the 8th brings the police, the 9th belongs to vomiting, and the 10th to insanity and the hurling of furniture. So I think there are some things that have changed, and I think that's what this conference is about, really. We've developed a much better understanding of the harm that alcohol does to the health of the population. And like other areas of public health, with that knowledge comes some concern about how we reduce the amount of harm. So as well as smoking, which I've already alluded to, there are some other examples where the growth in knowledge about health has influenced policy, it's influenced health messages, and eventually, to some extent, has influenced behaviour. Going out in the sun less to reduce skin cancer, eating less butter to reduce heart disease, and there have been health benefits from these changes. But in contrast, increasing knowledge about the health effects of alcohol has not been followed by slowing of consumption in New Zealand. And the groups that have historically had a low prevalence of heavy drinking, like the very young and like most women, are adopting more and more unhealthy patterns. And while there's a great deal of concern, it's been carrying on. Part of the reason for the lack of response is that the control of the sales and marketing of alcohol is effectively in the hands of the corporations that profit from its sale. So I think the really big difference between drinking now and in past generations is the alcohol company organisation and the size of the business that commercial alcohol is now. We can't reduce harm from drinking without reducing the drinking itself. Often the messages from the companies and from the politicians is that we need to do something about the harm, but we don't really need to do something about the drinking. We do need to reduce heavy drinking episodes, both the amount consumed and the frequency. And we know that this can't be done on a large scale by targeting individuals. And that's because the harm doesn't result from the actions of a few, as we're continually told. The harm results from the pathological drinking pattern of the country. This will be very familiar to you. We know quite a lot about what works to reduce alcohol consumption and the flow-on effects. The regulation of the alcohol marketplace is required. We need prices to go up, accessibility to be reduced by limiting outlets, by reducing hours and days of sale, by raising the purchase age. We need to lower the legal drink driving limit, and we need to get alcohol out of supermarkets. There's evidence that regulation to achieve this would be effective, and there's high public support. And these figures are from the Health Sponsorship Council survey. So, high public support. This is Rebecca Williams here in 2010, and I think those of you who saw the publication that's out on the front bench, this photograph features in it with an explanation of where it fits in. But these solutions are currently being blocked, and the question really is, what are the barriers to healthy alcohol policy? The alcohol companies need to sell more alcohol to keep their profits growing. This means they need to get more alcohol consumed, and in New Zealand the environment is completely saturated in alcohol already. So there are very few who can't access alcohol from the age of 15, who can't afford the cheap prices. Drunkenness is highly tolerated and even venerated. Children are supplied by their parents, and a few supermarket chains control most of the supply and set the price. But because almost everyone drinks already, increasing consumption means that each drinker needs to drink more. And this is a real marketing challenge. But there is a lot at stake, and the resources for doing this marketing are virtually unlimited. The revenue for Anheuser-Busch in 2008 was about $40 billion US dollars. So they have the money to do almost anything they need to do. Generic solutions are continually being developed that can be used all over the world to increase consumption. Because this is not about New Zealand. Where's my map? There it is. We're caught up in a worldwide global phenomenon. There is a WHO global strategy now for reducing the harmful use of alcohol, and it will need to take control of the alcohol supply from the industries that profit from it in order to be effective. I'm very much looking forward to the presentations and discussions today about how alcohol marketing might be working and looking for intervention points where we may be able to influence what happens next. Thank you very much. Does anyone have any questions?
Jennie, thank you for that. Is your presentation and our other presentations going to be available on the Alcohol Action website? Or do you need to take these notes?
Yes. Apparently. Yeah, no, you're welcome to it. Yeah. Is there anything else anyone would like to ask? Yes.
Gordon. Alcohol Action, South Canterbury. If alcohol is carcinogenic, is there any safe level?
No, well, we're limited to the evidence we have, but no, I mean, there's no identified threshold. And it's certainly, there's a lot of, it all comes with caution, all that evidence. But certainly where all of the studies on breast cancer and other kinds of cancer have been synthesised, there's no evidence that it's a safe level. So it's a proportionate increase in risk. So if you're, for example, with breast cancer, if you're a very young woman, realistically your risk of breast cancer is very low. So a 10% increase is 10% of not very much. But as you age, of course, it becomes very significant. Yes.
Tony Taylor, Victoria University. To what extent is the material which you've prepared given to schools of marketing?
Would you like to expand on what it is you're asking?
No, I wouldn't like to.
Oh, okay.
It makes me so angry that universities just might be in danger of acting so unethically that they are harming the population at large by training people. I mean, I put to cause harm in the same way, for example, that schools of accountancy are training their students to teach the corporations to avoid paying their taxes.
So the evidence that I've been talking about is all available publicly. So it's there. If the question is whether people are looking for it. But we do have a professor of marketing here to speak today, so maybe we could direct that question to her later. Yes.
Yes, I'm Sarah Crawford, and I work as a dietitian in private practice at Ropaca Medical Specialist. What I'm interested in, I see it frequently young women about 40 being diagnosed with breast cancer, and they're actually not aware that they're actually large drinkers. Because they actually, and their friends and social group and family will see them as big drinkers, because they hardly drink anything, and then they will drink an enormous amount of a social function, so they're actually binge drinkers. And I don't think people are aware that actually binge drinking in that age group is actually of any danger.
No, I mean, anecdotally, that's what I see as well. I think there's another phenomenon, having passed through that age group, of thinking that a couple of large glasses of wine at night, most nights, is not much.
No,
when in fact it might be 3 or 4 standard drinks.
Yeah, I've actually done that exercise with several friends, those large glasses, and then measured them out in 100 ml, which is the standard drink, which actually looks rather
mean.
And actually, it does look very mean in the very large glasses we actually provide people with. And if we go back to the standard glass we have as children, those glasses, the alcohol doesn't look mean, it looks generous. And often people have drunk a bottle of wine without them actually realising when you actually fill those glasses up.
So there's that, and then there's the phenomenon of I mean, men do it as well and have been doing for a long time, but of getting the girls together for a special night out, which involves getting completely trashed.
And the other thing is the CA of the assault, because you didn't actually show that, but that's actually increasing in our population as well.
So there's a whole range of other cancers. I think breast cancer, until people stop saying, I didn't know that, I keep talking about breast cancer. But there is a whole range of cancers where we've had evidence for a long time that's association with alcohol. Yeah, thank you. Any other questions? Oh, sorry.
Hi, Jennie.
Yes.
I'm Amanda Dodd. I work for the Cancer Society in New Zealand. One of my questions really is building on what other people have said in terms of public knowledge of the risk without alcohol and cancer. I would say it's not really there. In your opinion, your experience, where do you think we should really target on resources in raising that knowledge?
I'm not sure how to respond to that. I mean, perhaps it's something that we could discuss further with the people who are here. Actually, I think we have a big pool of expertise here. I have had some conversations with Cancer Society people, and I understand that the Cancer Society was looking at doing some housekeeping before they got into this in a big way, to make sure that their own connections as an organisation with alcohol had been expunged before they got really out into the public. I don't know where that's got to, but I understood that it was being held up slightly by the need for the Cancer Society and lots of other organisations to make sure that they had really severed all their connections with alcohol industry funding and other strands like that. Yeah. But I think it's something we should talk about, because I think it's quite apart from the need to inform people about their own health and so on. It certainly from the position of being an activist group, cancer is something we need to get out there as a message. Yes, Rebecca.
Just sort of building on that point and your response to that point, I think it's useful maybe to consider what marketing really is and the kind of spread and function of that, and those relationships that the alcohol industry build over time is part of that process. So I think it's, we're talking about the advertising and the obvious sponsorships and things like that, but I think we also need to be thinking about strategic relationships, partnerships that they've developed over many, many years, and how kind of tight those relationships have become.